Hi guys, today I'll be talking about toxic neuropathy. So let's begin. Definition is very simple. Basically, toxic neuropathy is a peripheral neuropathy. That is, a peripheral nerve is being affected by any substance which is coming from outside the body. It can be drug, it can be heavy metal, it can be a toxin, it can be an industrial agent. Okay, so that is the definition. It is very simple. Any drug, any heavy metal, ठीक है, heavy metals में there will be lead, arsenic, any toxin, industrial agents, ठीक है, mostly it is a hexacarbon. So now we can see this table from Harrison, which let us see where our topic of discussion lies. So just a minute. So toxic neuropathy is here. This is what we are talking about. So how do we start? A patient comes with complaint of neuropathy. We examine the patient and history, take the history which suggests there is neuropathy. Okay, and then we find out that it is a polyneuropathy. So what is polyneuropathy? Polyneuropathy means that multiple peripheral nerves are being affected. Okay, unlike mononeuropathy in which a single nerve is affected, uh, that is mononeuropathy. Mononeuropathy multiplex means a single nerve in different areas is being affected, and polyneuropathy means that multiple peripheral nerves are being affected. And the most common pattern of distribution is a glove and stocking type of pattern in which the legs and the arms will be affected. So there is a polyneuropathy. Then we do the electrodiagnostic study, and then we find out that it is a axonal type of degeneration. Okay, we'll come to this later. And among the axonal degeneration, when we take the history comes out to be it is having a subacute course of over months. Okay, subacute here means usually between 4 to 8 weeks. Okay, इसको हटा देता हूँ. So basically, polyneuropathy of axonal type having a subacute course is what we call toxic neuropathy, and it is due to substance coming from outside the body. ठीक है? So so it is a polyneuropathy of axonal degeneration with a subacute course. ठीक है? ठीक है. Other points to remember are that first of all, we know that the peripheral nerve is made up of motor fibers, sensory fibers, and autonomic fibers. ठीक है? Motor fiber has highest myelin, so you can remember it like M, motor, highest myelin, M. So motor fibers will be having highest myelin. Sensory fibers have less myelin. ठीक है? So when there is axonal degeneration is happening, then sensory fibers are affected first. Motor fibers can be affected or may be spared. ठीक है? So when we're talking about axonal degeneration, then sensory fibers are affected first and mostly, and motor fibers may or may not be affected in the late stage. When we talk about demyelination disorders, in those diseases, the since the motor fibers have higher amount of myelin, ठीक है? Since motor fibers have high amount of myelin, so they are affected first in demyelinating conditions. ठीक है? Now in this topic we are not talking about demyelinating disorders, but to give an example, what are demyelinating disorders? एक one is GBS, one is CIDP. ठीक है? One more that we can say name is Charcot-Marie Tooth disease. Okay, so toxic neuropathy, polyneuropathy, axonal degeneration, subacute course, and since it is axonal degeneration, sensory symptoms will be most predominant. Okay, motor fibers are not affected because this is not a demyelinating condition. Okay, okay. So long axons affected first, legs, knees, hands, stocking glove. Chief complaint, since we know axonal degeneration में sensory are affected, most importantly, so sensory complaints: numbness, burning, tingling, pinprick. Okay, long axons. Okay, on doing nerve conduction study and EMG, uh, first of all we know that myelin, it is maximum in motor nerve. That is one thing. Myelin का function क्या? Myelin is responsible for the speed of impulse. Okay, So if there is a demyelinating condition, the myelin will be less, so the speed of impulse will be less. So how is it the speed measured? It is measured by conduction velocity. So in demyelinating conditions, there will be a decrease decrease in the conduction velocity, known as CV. Also, conduction can be stopped, which is known as conduction block. So conduction velocity and conduction blocks are seen in demyelinating conditions. Axonal degeneration में both velocity is will be normal and there are no conduction loss. So this is normal. So what happens in axonal degeneration? The axon is responsible for amplitude of the uh, potential. So if there is axonal degeneration, A stands for axon, A stands for amplitude. So the amplitude is the only thing that is affected. So sensory nerve has also one amplitude and motor nerve has one amplitude. Sensory में it is known as snap, 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 and motor में similarly it is known as CMAP. ठीक है? So snap and CMAP both will be decreased. So conduction velocity normal, no conduction blocks, and snap and CMAP decreased in axonal degeneration. What happens if we put a needle inside the muscle and check for activity? Since axon has degenerated, muscle is now free, muscle will show spontaneous fibrillations and fasciculations. ठीक है? Fibrillations and fasciculations. These are not seen in demyelinating conditions, only in axonal degeneration this will be seen. Okay, just to complete the topic, what are the different causes of toxic neuropathy? First and foremost, the most common cause is alcohol. Okay, alcohol is the most common cause of a toxic neuropathy, and besides alcohol, we can remember that A stands for arsenic, amiodarone, L stands for lead, C stands for chloroquine, hydroxychloroquine, O for oxalic platinum, H is for hexocarbons, those people who do smell glue a lot. O stands for organophosphates, okay, which occurs 3 weeks after the organophosphate poisoning, and one antibiotic that we can remember is linezolid. Others are also there, for example, isoniazid, okay, vitamin B6 toxicity, okay, vitamin B6 and isoniazid. So some specific points with regard to each toxin is when there is arsenic poisoning, we can see Mees lines at the base of fingernails and toes. Where with regard to thallium, there will be alopecia and autonomic symptoms. Okay, now I remember that when I was talking about this in the starting, I said that toxic neuropathy is axonal degeneration, and since it is axonal degeneration, sensory symptoms will be more, with one exception, that is lead. Okay, because in lead there is axonal degeneration, but predominantly the motor axons are involved. Okay, since motor axons are involved, so only in this case there will be motor symptoms first, and arms are involved first. Exact pathophysiology is not known, but there is wrist drop, finger drop due to motor axon degeneration. And on PBF, there will be basophilic stippling of RBC and bluish black discoloration of gums. Okay? One more thing that to remember here is coasting effect. What is coasting effect? It is seen with platinum compounds in chemotherapy, in which there is symptoms will worsen despite stopping the drug. Okay, treatment of toxic neuropathy is removal of the offending drug and the patient will come back to normal. But in case of chemotherapy, there is something known as coasting effect, in which the symptoms will keep on increasing for 2 to 3 months after stopping the drug, and then patient will say that I am not improving. That is known as coasting effect. So how do you treat this patient? First of all, you identify and stop the agent, and specifically for isoniazid we give 100 mg per day pyridoxine. For lead there is chelation is available. Chelation is also available for arsenic with BAL. For thallium, Prussian blue can be given to stop absorption from the gastric mucosa. But once absorption has happened, we use forced diuresis for treatment. Treatment options are TCA, tricyclic antidepressant, opiates for pain, and one more is topical capsaicin cream. Okay, that is all.